Welcome back, everyone. I'm going to eventually turn my camera off, but I thought just for the introduction of the presentation, I'll come back on. I know some of you joined a little bit late, which is totally fine, but if you have not yet put your attendance in the chat, please do so, just your name and agency so that I know who to send the continuing education certificate to. That would be helpful. And we will go ahead and get started with our presentation. So it's kind of two-part. Beth and I will be covering the revised medical documentation form in detail, and then going over the updates that have recently been made to policy 765 medical documentation that will take effect to July 1st. And if you have any, I have a lot of screens open, so I'll try to look for hands in the chat. But Conrad or state staff, if there's any questions that come up during the meeting, feel free to interrupt me so that I can make sure I'm answering questions.
Okay, perfect.
Thanks. So yes, feel free if there's anything that we're presenting on that you want us to repeat or yeah, need clarification on, feel free to interrupt. The other thing that I just want to mention before we get into this is that for this particular lawn meeting, I'll be sending 2 follow-up emails. So one will be for those of you who are here live attending for the certificate, and then I'll send a separate email with the slide deck and a bunch of resources that we'll talk about today to all local agency WIC nutritionists and coordinators so that everyone gets that information. And then lastly is, I know not all local agencies can make these meetings. So this meeting is being recorded and it will be posted to our YouTube page and linked on our website so that you can go back and re-listen to it or share with other local agency staff who may find this information helpful. So we will go ahead and get started. And thank you everyone for adding your attendance in the chat. All right, so today's presentation, we have 4 learning objectives. So the first is to compare the previous and current versions of the medical documentation form. We hope that you're also able to explain the requirements of the healthcare provider in section C. The third learning objective is to identify the new elements that the WIC nutritionist must review and approve before assigning and tailoring a participant's special food package. And lastly is to restate the requirements outlined in policy 765 for approving a formula with a verbal order. So we'll go ahead and get started by just taking a look briefly at our current form on the left and then our revised form on the right that takes effect on July 1st. So really there are kind of 2 main buckets of changes that went into this form. The first is the new food package. So the final food rule was released in 2024 from USDA that had some kind of different and new requirements of the healthcare provider for those receiving a formula or have a special food package or food package 3. So that has kind of informed some of the changes, particularly in section C. But that also we use this opportunity to kind of put in some different pieces of OHP being the primary payer. And I'll go through top to bottom of this form to kind of highlight the changes. And then we'll take we have 3 examples, kind of focusing in on section C where the most changes have happened, just to kind of give you a better idea of what would be allowed and not allowed in that section with the new changes related to the final food rule. So we'll take a look at that. And then we'll also talk a little bit about some of the resources that we have available that kind of accompany this form revision. So starting out at the very top of the form are the instructions. So a couple of changes here is the first bullet point, we kind of shortened it a little bit. So it used to say this request is subject to WIC approval and provision based on program policy and procedure. We just shortened it to say this request is subject to approval per policy and procedure. Because we also needed a little bit more room on this form, so we got a little bit creative. We also wanted to add a 4th bullet point here that says Medicaid is the primary payer for medical formulas. WIC can provide this until OHP issuance is established. And you might also notice, at least in the last, when I did the side-by-side comparison, the MDF will be a fillable form like it is currently on a PDF, but these snippets don't have the fillable version just to make it look a little bit cleaner. But the form, once it's published and posted on our website, will be fillable electronically. So those were the changes for the instructions. And then section A, we added the patient's OHP number line on the right there for improved coordination with healthcare providers regarding coverage of medical formulas for shared clients. So this isn't a required field, but it can be helpful for that care coordination with the healthcare provider, or if you end up referring a participant to ombuds and have this available, or the CCO care coordinators, this just can be another helpful piece of information to provide them. But also, hopefully, I mean, in theory, I'm not sure how this is going to work in practice, but it could just be a reminder to healthcare providers that, yes, this participant, if they have OHP, maybe that could be a reminder to them to go through OHP first or simultaneously for medical formula approval. And then we also had some great feedback from a local agency about the second line that used to say patient/caregiver's name. And so we changed that to say parent/caregiver's name, last, first, and middle initial. And then moving on to section B. So what you probably will notice right away is that there are fewer options available here in this section, which we'll talk about on the next slide, but just wanted to give you section B here at a glance. So 1, 2, and 3 have not changed. It's really the table that have the changes in them. So the formulas that were removed from section B are still available for issuance. So the formulas that we removed from section B were ones that were seldomly issued in TWIST, and we used statewide issuance data to determine what formulas were seldomly issued. So for example, under infants and children, the amino acid formulas and the renal formula. Under children, also amino acid formulas and other specialty products. And then under adults, we removed Glucerna and Carb Steady as well. But again, those are still available for issuance and are still listed on page 2 of the MDF. So now I'm jumping to page 2, which is related, but the only change that we made to page 2 was just updating that Neocate Junior to Neocate Junior Cineo. That was announced at the last LAN meeting, that there was just a manufacturer change. So we just updated that name on page 2. But then for section B, because we removed some of those formulas, we did add a line for the healthcare provider to write in the formula. And we got a lot of great feedback from you all. So thank you. We wanted to make sure that we got this just right. So the other line spans across all categories, so infants, children, and adults. And then we wanted to make sure that providers knew that only the formulas listed on page 2 could be issued. So we capitalized that and underlined that so that if providers are free typing a formula, that they're at least referencing page 2 of our MDF. In section C, so some of my transitions didn't work out so well. Okay, so section C is most of the changes relate to the final food rule and kind of the food package changes that are happening with a special food package or food package 3. So the next slide has a picture of that section. So I'm just going to hop there and then talk through and click through so that you're able to see exactly what's changed. So we had a little bit of conversation about how can we kind of maximize the WIC nutritionist scope of practice to be able to determine supplemental foods. And so the first thing that we did was make this option big so that it's eye-catching with this checkbox so that healthcare providers are more inclined to defer to our WIC nutritionists to determine the supplemental foods. That might not be the healthcare provider's preference. They may want to kind of identify the specific foods that their patient should be issued through WIC. So for the rest of the kind of section C that's in this second red box here, kind of two different parts to this. So the healthcare provider is required to determine supplemental foods in section C unless they refer to the WIC nutritionist to tailor the participant's food package based on individual need and preference. If the healthcare provider does not defer to the WIC nutritionist to determine supplemental foods, the participant can only receive the supplemental foods that the healthcare provider indicates in section C, unless a new MedDoc form or verbal order is received. And Beth will talk a little bit more about the verbal order changes that are happening related to policy. The exception here, if and when a healthcare provider refers to the WIC nutritionist, is with the infant cereals and the pureed fruit and vegetables, as well as the whole milk. So we still need healthcare provider authorization for those three items. But for example, the low and non-fat milk and the plant-based alternatives here, those either require healthcare provider authorization, or those are ones that if the healthcare provider refers to the WIC nutritionist, that you can work with the participant to build out that food package. And we'll take a look at a couple examples, hopefully kind of help this make a little bit more sense. The other change that was made to section C was just the addition of the word Medicaid here. So now it reads very similar to how it read before, but now it will read whole milk and yogurt for adults and children older than 23 months receiving formula from WIC or Medicaid, no exceptions. And here are the healthcare provider requirements that I did just read, but they're here in text for reference. But I'm going to pause on section C and see if there's any questions or comments, or if there's anything that you'd like me to repeat about the new requirements for healthcare providers. And we'll have time at the end too, if I know I need some time to process things before I'm able to come up with a question. So we'll have plenty of time at the end. Okay.
Oh, hey, Ellen. We got one question in the chat just popped in.
Great.
So it looks like Greg asked, did you say that HCP can defer some, but not all of the options listed in section C?
Yes, good question. Thanks for catching me, and thanks, Greg.
Oh, and it looks like he added specifically the infant foods and the whole milk.
Yes. So, right. So our current process and policy is that we are, in order to issue for children to get the infant cereal in place of breakfast cereal and the jarred infant fruit and vegetable, as well as whole milk, the healthcare provider will still need to authorize those. But for plant-based alternatives, for eggs and milks, and then low and no fat milk, if the healthcare provider checks this box to request that WIC nutritionists determine supplemental foods, then you would be allowed to tailor the food package to include those. Is that making sense? Or if there's another state staff person that wants to say that differently, that might be helpful too.
This is Beth. I think I hope I think what we're saying is the infant cereal and the jarred and the infant fruit and vegetable benefit for children over the age of 12 months does need to be indicated by the healthcare provider. Did I say that right, Ellen? That's what you said, right?
And maybe when we get to the examples, that might be helpful. So okay, I'm seeing two questions. So Greg, So the healthcare provider might choose to defer to the WIC nutritionist, but the WIC nutritionist might have to then circle back to the healthcare. Yes. Yes, in some cases. And that's part of one of the examples that I have is kind of when you would need to go back to the healthcare provider. And we do recognize that kind of the new requirements in section C may have kind of additional back and forth. So that's why we were trying to, as we were putting this form together, trying to make it so that that wasn't an additional barrier, was kind of more communication with the healthcare provider, because that can take a lot of time and can kind of be tricky to get this form completed in the way that we need it. And then Sierra's question, maybe I'm nitpicking on the phrasing, but what if they are getting formula from private insurance, not Medicaid? I assume they can still get whole milk if authorized by the healthcare provider. That's a great question. And Mary Kay's saying yes. Okay, great. The plant-based milk, low-fat yogurt, and swapping eggs for beans and nut butters don't require an MDF though, correct? So so this, it's only needing healthcare provider authorization for those who are receiving a special formula or a special food package. But for participants who are not receiving a medical formula, that does not require a medical documentation form to issue those. Does that answer that question? Hopefully I interpreted that question correctly. Anything else on section C? Let me scoot ahead to those examples here. So
Well, we got
section.
a new question just came in. It looks like, so Valerie asked, so if they're getting a formula, we can't tailor the package unless the doctor checks that box, correct?
Yes, let me get to, I think this will be answered with some of the examples. So let me go there. And then if I still haven't answered your question, feel free to let me know. But real quickly, just to cover all sections, section D, there were no changes made. So that's staying exactly the same. So let's look at example 1. So in this case, the healthcare provider has checked 2 different boxes. So they checked for the WIC nutritionist to determine supplemental foods, but then they also checked the box for plant-based alternatives for eggs, so beans, nut or seed butters. So as the WIC nutritionist reviewing and approving this medical documentation form, you would honor the plant-based alternatives for eggs. And then if the participant requests plant-based milk alternative, the WIC nutritionist can assign that because the healthcare provider has also referred to the RD. In the second example that I have, however, the healthcare provider has not referred to the WIC nutritionist to determine supplemental foods, but they have indicated plant-based alternatives for eggs. So the food package would include the medical formula that this MDF is written for, as well as plant-based alternatives for eggs. If the participant were to request plant-based milk alternatives, that would require healthcare provider approval. So that would require either a new MDF with that box checked, or they're referring to you to determine that, or a verbal order, which again, Beth will talk in more detail about the changes happening there. So does that help clarify what the doctor is required to check in the event that they don't refer to you? I guess that wasn't worded very well. Okay, great. And then I just have one other quick example here, which I think kind of gets to Greg's question. So in this case, the healthcare provider is only deferring to the WIC nutritionist to determine supplemental foods and hasn't indicated anything else in section C. So then you are able to work with the participant to tailor their food package. But this is where if the participant is needing the infant cereal or the pureed fruits and vegetables or whole milk, that we would still need to see those boxes checked from the healthcare provider like we currently do. And when I send the slide deck out in PDF, I'll go ahead with these examples and kind of put those notes in there so that you can see kind of how you would review and approve this MDF. Heather's asking, with example 2, can we issue the other WIC foods like fruits, veg, whole grains, etc.? Example 2. Yes, so then the rest of the food package would be kind of the standard food package. Yeah, Mary Kay's saying yes as well. Okay, Beth's asking about example 3. If they need something that the healthcare provider actually needs to indicate, then that can be from a verbal order, correct? At least I would hope so, rather than asking them to submit a new MDF. Yeah, and I think Beth will cover this as well. I keep referring to your portion, Beth, just because the verbal order piece has changed. So hopefully I'm not misspeaking. And Mary Kay is saying yes to that. Brooke is asking, what if a non-RDN certifier does the appointment and requests food package changes? They would likely be unaware of the healthcare provider requests on the MDF form. It's a great question. And I know I don't know if this is answering your question. I know some local agencies will include, like, will write a progress note with all the details of the medical documentation form. So that could possibly be a place to include what the healthcare provider authorized. I don't know if other state staff have a better answer or more to add to Brooke's question.
I might just chime in about Brooke's question.
Yeah.
Because it might be one of those where I think your suggestion's a really nice one, Ellen, where the details of the MDF are, captured in the progress note. But it could also just be one of those triggers for a referral for RD review. Just especially as you're rolling out something new, right? So that could be another way to support making these changes for those special needs families.
Thanks, Mary Kay. I think that also maybe answers Nancy's question, who's asking if they were already given a plant-based milk by a CPA, would we then potentially have to remove it if the healthcare provider didn't check the box for plant-based milk? I'm seeing Heather's question, if section C is left blank, does that mean we cannot issue or assign any foods? So if it's blank, then they would get the kind of standard food package in addition to their medical formula. Greg is asking, as long as the food package changes are allowed for that client's category, there wouldn't be an issue, correct? And if it is a change that requires an MDF, then all staff should be trained on how to handle those requests and defer to the MDF/WIC nutritionist. Yes, Greg, and we will actually get to that kind of a resource for all staff that we have available. And then, yes, I think your first question is similar to Heather's, is what I'm gathering. That yes, if there's nothing in section C, and it's just an MDF for a medical formula, then it would be that and then the standard food package. It's just when they need the plant-based alternative specifically, or an alternative type of milk. Brooke says, okay, we can be more detailed in our notes and just make sure all staff are aware of this new requirement. Thank you. Thanks for the question. Valerie says, I'm a bit confused on why approval is needed for those foods at all. Yeah, great point. Yes, some of this is new and kind of the finer print of the final food rule that was released by USDA last year. And I have that linked towards the end if anyone's curious to take a closer look at that. But yes, specifically for participants who require a special food package, there have kind of been these additional requirements of the healthcare provider, which, yeah, again, we hope doesn't cause additional back and forth with the healthcare provider because of these new requirements. And I'll also talk about kind of a communication that we have for healthcare providers as well. So trying to kind of minimize that as a potential barrier with these new requirements. Richard is saying, this doesn't make a lot of sense to me. We can make these kinds of decisions for most clients, but if they are on an MDF, all of a sudden our hands are tied by the MDF. Yeah, which I think is, yeah, Greg agrees and was similar to the last comment. And Mary Kay also agrees. She says, we tried to make the RD WIC nutritionist be the default, but we were not able to get the approval from FNS. So yeah, originally we were kind of hoping that the default would be that the WIC nutritionist would assign the supplemental foods for a special food package. And we learned that it still has to be healthcare provider driven, which is why we kind of created this checkbox that says check here to request WIC nutritionist determine supplemental foods in kind of a big text, and hopefully the healthcare providers use that as kind of a primary option. Share that link now. Yes, well, if another state staff is able to share that link, that would be helpful. I'm kind of trapped in my screen sharing. I assume, Greg, you're talking about the final rule. Yes, okay, great, we'll get that to you. Okay, thanks for all your questions. Keep them coming, and I will kind of continue working through some of the other resources that we will have available for you all. And I kind of alluded to this. I think there was a question related to it. So we will have a job aid that's included as part of this presentation follow-up, and that will also be posted to our website with all the other food package. Thanks, Paula. With all the other food package resources. And this presentation obviously goes into a lot of the detail that's specific to the process of reviewing and approving a medical documentation form. This job aid is geared a little bit more towards all certifying staff, and hopefully it's helpful for clerical staff as well. It covers kind of who qualifies for a special food package, what's needed in order to issue, especially the kind of the details of section C, and then what has changed in the special food package. So that's an additional resource that we'll have available for you. And it's basically this presentation, but just not as detailed heavy and kind of the parts of the MDF changes. Another resource that we will have available for you is a letter template to healthcare providers. So we have two different versions of this. One will be sent by the state. It's the same exact information. And we'll be sharing it out kind of to similar channels that we did the Oregon administrative rule. So kind of different provider channels across the state, just to share this information. We have a new medical documentation form, but we'll also make available kind of a Word doc template for you to edit and use as you want to communicate more locally with your providers. And some of the things that we wanted to highlight in this letter are when the form takes effect, which is July 1st, that they're required to complete section C or refer to the WIC nutritionist. And then we also use this as an opportunity to remind them of OHP being the primary payer. And at the bottom, you'll see 4 different actions that we're requesting of our healthcare providers. One is to update any downloaded or print versions of the Oregon WIC medical documentation form, and to discard any that are dated 2023 or earlier. We're also requesting that they fully complete the form to reduce back and forth communication between WIC clinics and providers' offices, and then to issue only formulas from WIC, available from WIC by referencing page 2 of the form. Maricela asks, I'm curious if the new MDF could read WIC nutritionist will determine supplemental foods below unless indicated otherwise below. Great question. So this is how we originally wanted to create the form, but this is not allowable by FNS. It has to be provider driven. But that's a great question. Yeah, you're welcome. Meredith says, I find that I often have to walk the medical assistant or the healthcare provider through with which check boxes to mark when there are more changes than just formula. Is it okay after speaking with them to send a completed MDF? And if they are okay with the changes, they can sign off on it. I might pass that question to Beth.
Well, Ellen, that's a great question, Meredith. Maybe I need support from Mary Kay on this too, but I'm thinking yes. So you're saying, Meredith, you would fill out the MDF and just get it signed by them, by the healthcare provider?
Yeah, basically, because a lot of times I'll talk to the MA and they'll say, well, the doctor wants them on infant foods. Where do I check that? And then I usually have to walk them through the whole form on where to find things.
That is a great question. So is this sort of prior to getting any kind of med doc? So you're just calling the doctor's office saying, hey, we've got this kid who needs XYZ formula. And then, walking them through.
Yeah, I guess it tends to happen more with providers who don't work with these forms a lot. And they usually send me a letter saying they'd like the participant on this and such formula, or to have baby foods or whole milk. And then I, talk to them, show them where the form is, and then show them how to fill it out. It would be nice if after I talk to them, I can just send them the completed form. And if they're okay with everything, they can sign off on it.
Well, it does seem a lot like a verbal order.
Yeah.
To me as well, because you're essentially just, acting. You've had communication with the doctor. The doctor has sent communication, right? They just haven't completed the form, and so then you're walking them through, and then sharing the form back to them is just a way of making sure that you got it right, based on how you're understanding the doctor's order, right?
Yeah, pretty much. So that'd be awesome. I just wanted to make sure that that was all okay.
Yeah, I think so. I think I would attach the original communication from the doctor, because I think that just clarifies that you're not making the selections for the, you're trying to capture what you're getting from the doctor as opposed to making the decisions for them. But I think that's more in case of us being audited. But I think that seems reasonable.
Yeah, I definitely include that letter with
Mhm.
our completed MDFs.
Right. Yeah, I would just do that just as a good documentation, but yeah. Yeah, and you're sometimes getting through and getting a chance to talk to them is tricky. Like, anyway, I'm just acknowledging that sometimes it's really helpful to have a helpful MA on staff who can help navigate, right, to get the information from the doctor back and forth.
Great, thanks for your question. Okay. We talked about the letter. And if there is any, yeah, I think I mentioned I'll send the Word version of this template letter to you, and then you can, yeah, edit and send as you wish. And then the state will also be sending it out. But if you have a request of kind of a group of providers or people that you might want the state to send, please let us know. We'd be happy to add it to our list. Kelly has a question in the chat. This form isn't immediately obvious which check boxes require healthcare provider approval, even if they defer to the WIC nutrition box is the only box checked. Is there any way to make that more clear on the form instead of RDs or WIC nutritionists memorizing which ones those are, or am I missing something? That's a great suggestion. I know some local agencies kind of highlight the different areas that healthcare providers are required to complete. I've seen some local agencies do that. I know we didn't have that on the previous medical documentation form. I'm not sure if that's an option with this new one, but it's a great suggestion. I don't know, Mary Kay, if you have a thought.
Oh, just that the formatting of this form is quite a feat. So I'm not sure if when we were working on the format, if we thought about that fact that, oh, even if I click this, refer to the nutritionist, there are some things that still require the medical provider to indicate. So I'm not sure what solution there would be in terms of trying to create the form in a way that's not any more complicated than it already is. But if there was quite a bit of trying to get some feedback on it, but if you have some brilliant ideas, I think we'd still be open to doing that. But I do think it is not uncommon for things like some of the local agencies have done clever things, and somebody else might have some ideas for that too.
Meredith is suggesting maybe an asterisk next to those boxes that need healthcare provider approval. Yeah, we could certainly take these ideas back to our team that's been working on this and see, and our publications expert who's been helping us with this form to see what options we have and kind of think through some of those more. So great, yeah, whether it's kind of a highlighted or somehow indicated the ones that need healthcare provider approval. So yeah, we can certainly talk about that. Thanks for your recommendations. Okay. So I'm just going to recap kind of the different components that we talked about that we'll share out with all of you. So this training slide deck will be one that is shared out in that post-lawn follow-up email to all nutritionists and coordinators. And I'll be sure to include some notes on those examples, just so that those are a little bit more clear when you get that. We'll also share out that job aid that I mentioned, and that will also be posted on our website. I'll share out the letter template for healthcare providers. And then once our MDF is finalized, that will be available on our website as well as Shopify for ordering print versions. And then this link will be active. That's the one that Perla had put in the chat that Greg requested the final rule. And the last little piece that I would like to cover for the medical documentation form has to do with Shopify and print orders. And this is just so we can get an idea of how many packs of MDFs that we should send to our printers initially. So this, Conrad's going to help me with a brief poll. So the medical documentation forms are printed in tearaway packs of 100. So I know that not all local agencies are here, but we'd just like to get an idea, a rough estimate of how many packs your local agency would order so that we know how many to request from our printer. So if you could just free type in that poll that Conrad launched of how many packs of 100 your local agency would order. Oh, although I'm seeing this quantity says 50.
Oh, that was just previously, like they are in oh, yep, it does say pads of 50 forms. Sorry, I used a old picture just to get the for the poll, and so the new MDFs when they come in, they're going to be in packs of 100, not 50.
Okay, great.
Yeah. Sorry about that.
Thank you. No, thanks for that. And Hal, yes, so these will still be available as a fillable PDF on the website. So this is just for those who may order tearaway pads of 100. How many you think your agency would order to start? And then Conrad, feel free to close the poll whenever you aren't getting any more responses, and then we'll move on.
Okay, great. Yeah, so far we're at about 13 responses, so keep on trickling in. All right, we're at about 16. You want me to close it now?
Yeah, and it looks like a couple different local agencies just print on site. Yeah, okay. Yes, thanks, Conrad. That's great. That'll give us a rough idea of how many to send to our print shop. So thank you, everyone. Okay, and several of you don't think you'd order any packs. Okay, perfect. Thank you. All right. So for the second part of this presentation, I'm going to pass it over to Beth for policy 765 updates.
Thank you, Ellen. Hello, everyone. So yeah, my portion is to just talk a little bit about the changes that we made to policy 765, which is medical documentation. Just to give you a little bit of a history, we had a monitoring evaluation from FNS back in February of 2020.
Management evaluation.
Management evaluation. Yes, that's right. Thank you, Mary Kay. I just had a brain freeze there. And back in February of 2024, we were found to be out of compliance because of our allowing a 1 month of issuance for medical formulas without medical documentation. So we have gone ahead and updated the policy. If you want to go to the next slide, I think we're ready. Thanks, Ellen. So so with these slides just kind of go through the different sections and what's changed for this policy. So section 7.0 clarifies that WIC staff must receive either a written medical documentation form or a verbal order from a healthcare provider before issuing a medical formula. So we need to have something in writing or something verbal in order to issue even just that 1 month. So we can go on to the next slide. Section 10 identifies that medical documentation may be initiated by phone, however, that a written MDF must be received within 2 weeks of accepting a verbal order. So that's a big change. We're going to have to stay on top of that and get the written medical documentation form within 2 weeks. And next, so this is kind of going back to what Ellen talked about, all the changes to section C. If it's incomplete, it is acceptable to receive a verbal order for supplemental foods. Documentation must be included on the MDF and then in twist. This policy is effective July 1st. We will be sending out a policy memo to local agencies early next month for certifying staff to review no later than the end of the year, and then we are required to ask for proof of attendance of this policy memo to be submitted with the 2025 NSP Nutrition Services Plan evaluation to your assigned nutrition consultant. So basically, we need to have staff review the policy memo, make sure that they understand what the changes are, and then have the training supervisor or coordinator send in a proof of attendance that the staff reviewed the policy memo. And questions? Is there another slide? Yeah, questions.
Hi, Beth. This is Sarah from Multnomah County. I can't see the raising the hand, so apologies if someone else is waiting to ask something.
Oh, no, you're fine. Go ahead, Sarah.
So I'm thinking about clients that are that just moved to Oregon and are sorting out their OHP or their insurance and are on the special formula. Can we get a verbal from their healthcare provider from another state until they get their insurance sorted?
I would say yes. Yeah, Mary Kay says yes. Yeah,
Okay.
we can get a verbal from their healthcare provider and then follow up with a written.
We can also accept a medical documentation form that was provided by a provider in another state using a different state form, but we can honor that.
Yeah, so if there would be any way that they could get a hold of the previous local agency, yeah.
Perfect. That would be helpful. Thank you.
Stephanie, we have some standing orders in Washington County that our medical officer has for us. Is that something that would still be a usable option as a temporary, or do we need it to be from their current direct provider?
I'm sorry, Stephanie, can you say that again? I'm sorry, I got distracted by the chat. Please.
It's okay. We have some standing orders for certain medical documentation or certain medical formulas with our health officer in Washington County. And I was just wondering if that was something that would be an option to use temporarily while we're waiting to get providers. It's oftentimes like they're coming out of state kind of situations and don't have an established provider yet.
Oh. That's a great question, and I'm not sure that I know the answer. I guess I'm not aware of local agency standing orders. Is that something we maybe need to get back to Stephanie on?
You can get back to Tara on it.
Or Tara, yeah.
I'm the question asker.
That's great. And it might be nice to see what your standing orders are.
Yeah.
Because if that, because maybe it could be helpful for someone else too. Yeah, be interesting to look at that.
Okay.
This is Monica in Deschutes. Can you hear me?
Yes.
Okay, I had a question. I'm hung up on section C of the MDF, and you may have said it, but I did have a hard time hearing some of the presentation. But I did not see anywhere on there because it said in the letter that the doctor or the provider has to mark something in section C. But I didn't see anything on there that where the provider could just mark no changes to supplemental foods. And so is that going to be confusing to providers? Because everything on there is about omitting different things or allowing for like the plant-based items. And so if they have to mark something, are we just, would that just be useful and helpful to eliminate a back and forth between the provider? Is my concern on section C. Since the letter says they have to mark something.
Yeah, that's a great question. So the default is if they don't mark anything, they get they would just get, if it was a child, they would get the regular child package, like the standard or default package.
Right, we know that here in the clinic, right? But there are letters telling them to, I'm just concerned we're gonna have a lot of back and forth with the providers. Because we don't usually get section C filled out on a lot of our MDFs here.
Because yes, I see that maybe if they don't want to make any, like, don't want to check any boxes of the supplemental foods, but aren't, I mean, ideally they might just refer to you anyway. But still, yeah, that could cause some confusion. So that's something we could talk about and yeah, see what other changes we can make. I saw Mary Kay, you came off mute if there was anything else you wanted.
Okay, thanks.
No, I think I was just going to respond in the same way, Ellen. I think that if it's not filled out, you would assume it's a standard food package as opposed to, right? Isn't that, maybe I missed something.
Are you asking me?
No, yeah,
Okay.
no, go ahead. I just, yeah.
Okay, then I had another question about section C, or well, just actually about the MDF in general, mostly section C. So if we get the MDF and they're only asking for formula and there's no changes to the supplemental foods, so we provide that. And then a month or two later down the road, the family just calls us and says, hey, we're having these, we would like to have the plant-based foods. We think cow's milk is horrible for us. It's full of hormones and too much sugar. We want the plant-based milk, which is something we do here. Now, because there's an MDF on file for this client, we have to go back to the provider and say, hey, can you get permission for this? When a person who's not on an MDF could just call in and say, we want plant-based food, and we just give it to them. I mean, am I understanding that correctly? Because there's an MDF, we're going to have to go to the provider, even though it's these couple months have passed.
That's correct, Monica. Yeah. Either the verbal order route, but then that requires the written MDF.
So can you help me understand why? I mean, it just seems like it's creating extra work when.
That's a great
And the
question.
notion being that they've been followed and there's something medically going on, and therefore if any changes are needed, then the provider has to sign off on said changes.
Right. And for the discontinuation, I don't know that I have a good answer for that. I don't know if anyone else.
Because we do have families that will share like, oh, we got the okay to go to a standard formula out of their preemie, for example, right? So that in itself is going to a standard formula, but would be considered a change, right? So we need then an authorization to go to a standard formula from the healthcare provider if that nutritionist box was not marked. Because it sounds like in essence we're kind of opening Pandora's box in some ways to these minute little changes that we had the flexibility to do previously. But I also understand that the theory behind it of the provider needing to be involved in the selection of said formulas and care as well.
It looks like Greg has a similar, concern about families reporting that they have been approved to make a change and that all of this seems to make the process more cumbersome for everyone and add barriers to care for our families. Yeah, certainly, Greg, there are some potential barriers, with these changes, but as far as the approval to make a change or discontinuation of a medical formula, I don't know, Mary Kay.
It was not required in the past, right? If someone had a medical formula and they come in and the baby's doing great and now they don't need NeoSure anymore, right? This kind of thing. And they've been approved to go to standard medical formula. We've not been required to go back to the doctor and verify that. So I'm thinking that we would not have to go back if it's switching back to the more standard food package. That would be my interpretation. Beth, do you have any other thoughts on that?
But in some ways too, though, real quick, one could argue the same thought about going, like the example of going from dairy-based things to plant-based things, right? So I'm just curious where, I guess it depends on what the medical condition is, but it just kind of begs the question there too, that one could argue too, like, well, this would be appropriate or not appropriate. So that's where I guess it just gets a little murky, if you will, of kind of what the line is.
Right. And I do think there is some role for the clinical assessment of the dietitian or the WIC nutritionist in those situations. In terms of, anyway, just the level to which we're going to I just want to be mindful about how many extra barriers we create. So we do have certain regulations that we do have to live with, but if we can, reduce barriers also, that makes sense. But I can certainly see a family getting approval from the doctor to do a plant-based milk, and then, that doesn't go well. It's not well received by their family, and then they decide they want to just go back to the standard food package. I can't imagine that we would need to go back to the doctor and make sure that we get a verbal order. We would just, chart the information as provided by the parent, right, as to why those food package changes would make sense, or, why we would make those changes. But if the parent is asking for something that appears to be inappropriate, then it seems like it might make sense to do some coordination. What do you think?
No, completely. But if it made sense, it just seems like it'd be extra steps for something that's where I was just kind of getting clarification on that example of going from dairy to plant-based, because it could just be even a preference, right? And we usually try to be participant-centered and recognize those things if it seems appropriate, that aren't anything medically truly going on that would prevent them from being able to do that. Or because of cultural or religious reasons, we want to honor that. So I just was wanting to get clarification on potential additional barriers, like you were saying, we're wanting to minimize to make it accessible for more folks.
Thank you. I wanted to just circle back on a question that Greg had in the chat about Twist allowing the 1 month of issuance. So this is getting back to the policy 765 again, sorry. We are looking at making whether or not we can make that change in Twist. We have our developers, programmers looking into it right now. Because we agree that, you know, having to rely just on policy for not issuing 1 month of a special formula is not ideal. So we definitely are looking into that.
Are there any other questions about the form or any other resources that we talked about or policy? Kelly's asking, what if we're unable to get the MDF from the provider after a verbal order within 2 weeks?
So this was, this is one of those interesting requirements that we just have to live with. But my inclination would be you get the verbal order from the doc, you issue the formula for 1 month. And then this would just be my own way of trying to track this because you can't remember to go back to those charts to change it. But that you would issue for 1 month. And so then you're back to that same, at least there's at least some kind of tickler that you can have so that you can do follow-up if you needed to, or the family can follow up if you haven't gotten that MDF back, because otherwise it's not been authorized for more than that, right, by the medical provider. Sorry, did someone else want to answer that question? So I jumped right in.
No, these are all really, really good questions. And I think you answered it well, Mary Kay.
Marisol is asking in the chat, can you give us an example of documenting a verbal order in Twist?
I think that would just be in the progress notes, Maricela.
Yeah, but maybe she's looking for some specifics like, telephone call TC to such and such medical office for XYZ formula verbally approved or something like that. Is that what you're thinking about, Maricela?
Yeah, I think that's what I'm thinking about. So as we're moving into not being able to authorize a 1 month issuance of a medical formula, because we do either need the MDF or a verbal order. I'm familiar with MDF and documenting that in Twist, but I don't know that we've really dealt with verbal orders very much. So we don't enter it in the MDF section in Twist. It's just a progress note and you're just issuing a 1 month of the medical formula. So yeah, I guess maybe specifically where in Twist would we document and just kind of an example of verbiage. We just add a progress note, it sounds like, and just do a 1 month issuance.
So Beth, I don't know if you want to field this, but I think you could probably document it either in the medical documentation tab box, where you could say verbal order from Oregon Medical Clinic, blah, 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 for, due to, and put the diagnosis or whatever the situation is, why it's being approved verbally. You could put it there, or you can put it in the progress notes.
Thank you. And I'm seeing a response from Randy as well. Thank you, Randy. I was just curious if the verbal meant just like a 1 month until the actual document came through that told us the specific amount of months, but it sounds like it could be up to a year, which is the maximum that we could do in WIC.
Right, but you still have to get a medical documentation form in within 2 weeks, so you can issue a 1 month with the verbal order, but then they would only have 1 month, right?
Yeah. Okay. Thank you.
And Meredith is asking, does the verbal have to be from the healthcare provider directly or via a medical assistant or nurse?
Okay, if I jump in? I would be inclined, usually, often when you're talking to someone from the doctor's office, right, you might not be talking to the doctor themselves, but you might have a medical assistant or a nurse, and they're reading from the chart saying, because the healthcare provider has indicated in the medical notes, in their Epic or wherever, what the formula that's being asked for and for the reason. So they're telling you that from the medical record. And that to me seems sufficient. I don't know if anybody else has a different thought about that. But if they're reading something from the healthcare provider, that seems adequate to me.
Really great questions, everyone. Thank you so much. We just have a few minutes left in our meeting today. If there are any other questions or requests or anything else that would be helpful to support this transition. All right, well, thank you everyone for joining today's meeting. I hope to see you in August. Oh, we just had another question. Will there be communication going to healthcare provider offices about the 1 month?
Meaning, are you on a state level going to be communicating with provider offices about this change? Because it's obviously going to be a change for a lot of provider offices that they're going to have to move quickly in order to support families because of this new requirement, and that families may not get formula otherwise.
Great suggestion, Jennifer. Yes, we will take a look at our state communication that's going out and see how we can fit that in there. That's a great suggestion. And if there are any other questions or requests, feel free to reach out to Beth or I or your assigned nutrition consultant. And then we'll meet as a team to take back some of these questions that you raised that we don't quite have answers to today. And then we can, we'll be sharing out some of these resources to you as well, kind of in a packaged form via email to all nutritionists and coordinators. So thanks everyone for your time and your input and your questions. Hope to see you in August. Have a great rest of your week. Thanks everyone.